this is Pallavi Goel and welcome back to the Season 3 of Rise of India's Digital Economy, powered by ETRetail's E-Commerce and Digital Native Summit 2025. Joining me today for this special episode is Prashant Tandon, the co-founder and CEO of Tata 1MG. Let's go. Hi again, Prashant.
Hi.
So, Prashant, the idea of our series is Rise of India's Digital Economy. And first things first, you're in the business of health. Which latest health app or health gadget you're using?
I actually use my health watch regularly. I'm not wearing it right now, but honestly, I think it's changed my behavior quite a bit. It's something that shows me the power of just getting the data and monitoring. It just changes your behavior a little bit. Every day when you see now a little bit, the steps are pending. I push myself to have a little more walk. Sleep is not good. This, that. I think just monitoring, measuring, and seeing it makes a big impact.
No, that's true. I think they motivate you and they put you in guilt at the same time.
Yeah.
So that's there. But anything interesting you learned about the consumer while using these apps or gadgets?
That the consumer actually needs support to change the behavior, and the biggest support is just transparently seeing the mirror. If you're just able to see what is going on with you, how you're doing, I think as a consumer, you figure out ways to help yourselves.
Yeah, I think that's a very powerful statement. Thank you. Prashant, in this series, we talk to a lot of digital first businesses. And while these businesses attempted to transform traditional markets, I think the biggest challenge has been building consumer trust.
Yep.
You started a decade back. How did you approach trust building? And in this process, has there been a pivotal moment when something changed, something clicked?
In the business of healthcare, trust is the fundamental currency. If you don't have trust of your consumers, you don't have a basis to survive. You don't have a reason to exist. So, but trust is not a marketing campaign or one thing that you do that makes people say that, okay, I trust you. Trust is what you do, pretty much everything you do, every single interaction the consumer has, your philosophy of how you're building the business, how your systems processes deliver that at every touch point, thousands and thousands of touch points across the country. So, and trust is one of those things that takes pretty much eternity, and everything you do has to work for it to be built, and it can be lost with one shortcut or one loss of trust moment.
Yeah.
So I think as a company, we try to do the right thing and put the consumer at the center of our platform. I think that's been a founding ethos of the company. Why do we exist? We exist because we believe that healthcare should be consumer centric, patient centric. We believe that for that we have everything we do has to be right by the consumer, and then I think the organization over a period of time has evolved in a certain way. We are very grateful and thankful to see that our frontline folks, who I'm very, very proud of, how they put the consumer at the center. That's what builds trust in the company.
Yeah, I think again a very important point, the front line, the ones that interact with your consumer day in and day out. Now, you're a brand which is both in healthcare consumers as well as delivery, right? Today, when there is competition intensified across channels, do you think it has become difficult for brands to get customers' loyalty, get their trust? How should they approach it today?
I think, see, I honestly believe there's no shortcut. You have to keep doing the right things, and I am a strong believer in the power of compounding and the power of genuine value being appreciated over a period of time. You have to have patience about that. So I think at one level, just keep doing the right thing, and hope it gets appreciated at the right time while you're still in existence. But I don't see any shortcut. I don't see any alternate way to do it. You have to have a very clear focus on what value are you adding to somebody's life. I think that has to be important. If you are not trying to add or create genuine value, then it's only a limited amount of time that you can steal share from here, there, or anywhere. So you have to have a thought on that. What am I bringing to the table? Why do I exist? Why do I deserve anybody's attention as an organization, as a company? And then stick to it, put your head down and let the power of compounding play out. And I think that's something that our organization has done well. People always think of what better can I do, what more can I add, and then the results, financials, profits, all those follow.
Yeah, I think my biggest takeaway, the power of compounding. Absolutely, yeah. Um, Prashant, as someone who has been in the, in this business for about 15 years now,
Yeah.
uh, what does an ideal inclusive health model look like in your vision?
See, healthcare at the end of the day has to work for the patients, for the consumers, and they have to feel and realize the benefits of the healthcare ecosystem. Now, for that, for an inclusive model, it has to be affordable, yes. It has to be high quality. It has to be accessible. Historically, how healthcare has been built and delivered is a very clear urban bias in the way that you have to be in that zone to access the right quality of healthcare. Um, the cost of healthcare access actually is higher for people living in tier 2, 3, and 4 because they also add the added cost of transport to the big city to get their healthcare. They have the cost of many middlemen, brokers, and other people guiding or misguiding them on how they need to deal with it. So the model is now historically not stacked in a very fair or equitable way. But technology is a great leveler. Technology ensures, first of all, the base of it is an informed consumer demands quality, expects quality. So that's one part. Understanding of healthcare, the digital world has opened it up. The second part is the access of healthcare. Now, where the physical infrastructure would take time to build, and yes, secondary, tertiary care, no alternative, but at least figuring out the primary care part, and secondly, which secondary and tertiary options are working or are optimum for you. All that is done through technology in a free and democratic way rather than one tout, one agent, one middleman trying to lead you to his own or her own profit maximization model of giving you healthcare. Now, so I think information has power, and then access through the digital platform can at least bring the high quality doctors to you. Now, the third part of it is the quality of the delivery of healthcare, and that's where I think we are seeing a fundamental change with AI and IoT. So a lot of signals, the body keeps sending out signals. These signals are getting collected real time and getting transmitted. So there's a lot more real time work happening. But more importantly, what AI is able to do is that the entire collective wisdom of the medical world, and it could be the latest research in any part of the world, is accessible to these AI bots. They have seen and they have the ability to process patterns over a long period of time. Like, how does a doctor get really high quality over a period of time? Is because they've seen so many patients, they've seen so many patterns. Now these AI bots can see literally infinite patterns and have access to the knowledge bank of the entire world. Think of how powerful that is, and that is becoming accessible to the person sitting in a tier 4 rural city of the country, and that person there can actually tell his complaint in his native language. It gets automatically translated into a language that is understood by this system, and the system is able to move forward with a lot of the diagnosis and analysis.
Wow, I think that was a super honest answer. Thank you for being brutally honest. One such experiment, which has, I think, taken the entire industry of storm, has been quick commerce. And that is now extending, of course, to the healthcare ecosystem too. First, what are your thoughts on quick commerce as a model?
So I think uh, I take it from a very basic value. Number one, in pharma, there are genuinely areas where quick delivery is required. So if you have an acute situation, you need things quickly. There's a genuine need. So there is a requirement of an infrastructure that can deliver healthcare quick. The second part of it is what is the sustainable model of quick commerce, and equally or even more importantly, how does it ensure that uh, the primary variable is still quality and not speed? I think healthcare, that is one nuance that one has to be very careful about. That just you cannot compromise your quality systems just in the pursuit of speed. So how to do it properly, how to do it in the right way takes a lot of science and processes and systems behind it. We believe we have figured out the right way to do it. We are actively expanding our brick and mortar retail presence. We today have 100 stores. We'll have a few thousand in a couple of years. um, these stores would be your neighborhood stores, which will enable quick deliveries to as required, while maintaining our last 10 years. We've learned a lot about quality, compliance, processes, systems, so that those things cannot get compromised as the prescriptions come to us, as we analyze them, as the pharmacist dispense. Dispensation errors should not happen. See, medicines, it's complex. We've got around at one NG, we sell around 800,000 products. It's a very large portfolio. A lot of products look alike, sound alike. Lasa, it's known as a industry term where you need to make sure you don't make the mistake that you pick up and deliver something that kind of sounded similar, but in a hurry you did that. How do you do that? How do you stack your warehouses in a way that you don't make those mistakes? Your systems have to work pinpoint accuracy. So we've mastered all of that over the last 10 years, and now we bring those learnings when we jump into quick commerce. So we do it with the core strong, and now how fast can we go? And we do it through our physical neighborhood store. So I do believe we have a model that is both high quality, sustainable, and will deliver.
Excellent. And so you already have 100 plus stores in the country. How many stores do you target over the next 5 years or so?
I think we'll be looking at around 3,000 stores in a 5-year horizon.
Pan India.
Pan India, yes.
One another extension of the digital health model that we discussed, Prashant, is the policy angle of it.
Yeah.
And again, as someone who has been in this for over a decade, and you've been in conversation across the two sides of the party, what is the official stance on the policy? And also, as a player, what would be your expectation which will help the entire ecosystem move forward?
See, the policy, there are 2 3 parts. Number one, of course, the law of the land is supreme. Everyone has to comply with that. We make sure we are in full compliance of that. The second part is, how should the regulatory systems evolve to keep in pace with the innovation that is happening in this landscape? And I think that requires the key players, the responsible players, as well as the regulators and the government, making sure there is continuous interaction, continuous dialogue, and it'll only accelerate the pace, because now when we see what AI can do, IoT can do, all these big changes coming in healthcare, what can they do? The regulator needs to, one, beef itself, its own capability to deal with it and understand it, and secondly, it needs to engage with the ecosystem, the digital health ecosystem, the startup ecosystem, so that it's in lockstep. There is an active dialogue. Now, the reason that our sector took off at some level is that the dialogue was very consistent and all along.
Prashant, there's also one thing which makes 1MG, one of the successful case studies that a lot of young entrepreneurs look up is, you're a Tata brand since 2021. Now, if you could take us back to that conversation,
Sure.
How was it discussing between you and Gaurav and of course the Tata team? What was the first discussion like, and why did you guys make that decision?
So, at that time, we had just closed a financing round with financial investors when the conversation from the Tata Group came to us. And Gaurav and I at that time we were thinking, what's the right thing? What do we want to build? And what's the best partner we could have in this journey? And I think it was fairly clear to us that our ambition, our aspiration is to build the most significant, the largest, the most defining healthcare company of the country. And for that, it is important to have a long-term strategic view. And amongst all the strategic players out there, I think that the trust that the Tata brand commands, the respect that it commands, the ethical governance systems that the group is known for,
Prashant, I'm seeking a word of advice here for the entrepreneurs out there. In the market conditions, this year, the previous years, there has been a lot of consolidation, a lot of strategic deals which have come out, and a lot more to happen. Uh, as someone who has lived that journey, and of course, as a seasoned entrepreneur, how do you one view the movements in the ecosystem, and second, what would be your advice to a 6 year, a 10-year-old brand which are maybe contemplating this?
No, so I think first of all, uh, if and it really depends on why two brands come together. The fundamental thought process needs to be very clear, and I think the deals that are happening, um, the entrepreneurs need to really make sure they think through why they are getting into this deal. What is the value that will get created for your customers and businesses at point number one. Secondly, are they mentally in a position that or zone that they want to and can make it work?
Yeah.
That will require effort. It will require um, embracing a new partner and new way of operating. So, and once those things are well clear and answered properly, I think that's when the mathematics comes into play. Then the numbers have to work.
Sure.
So sometimes we put the numbers ahead of the more important things. It's important to make sure that the strategic questions are well answered before you start doing the math.
One other thing that every brand today is doing, they're building for the next generation, right? Gen Zs are not just your consumers, they're also your colleagues. I can see a lot of Gen Zs around. Yeah, how has it been? Anything interesting you're learning about them by working with them and also by catering to them?
Yeah, they're definitely a lot more aware, a lot more restless, and a lot more, I think, socially conscious. It's the degree of awareness, the amount of, I think, media that they have been exposed to, has it took us a lot of while to get to that level of awareness about a lot of things. So I think we have a, a, a Gen Z community that operates in a slightly different way, and it's great. I think it's great because you can actually engage them. They want to engage. They are. It's not an apathetic kind of a generation. It is a very involved generation, and I think that presents a great opportunity for companies and marketeers to actually build relationships with this community.
Excellent. Thank you so much for your inputs, Prashant. This was a wholehearted conversation, and I absolutely loved you being so honest. Thank you so
No,
much.
no, thank you for this conversation. I really enjoyed it.
Thank you.
Thank you.
For more such conversations, stay tuned at ETRetail.